The doctor shortage in Idaho is a very real thing, but it isn't really a new thing. 22 years ago, the American Medical Association put Idaho last on the list for physicians per 1,000 people. 35 of Idaho's 44 counties were federally designated as medically underserved in 2008. Well, not much has changed since the aughts, but in the last 15 months or so, a collection of Idaho doctors say it's actually getting worse now. The recent numbers should concern every person living in or considering a move to Idaho. That's according to the Idaho Coalition for Safe Healthcare. They are the parent organization to the Idaho Physician Wellbeing Action Collaborative. It's a smaller group started by Doctors Deb Roman and Dr. Edward McGeekern to bring their community together to solve some of our healthcare issues that we all face. Well, they put together some numbers in a post-Roe Idaho report. They put that together this week, and it's based on what's happened with doctors since the Dobbs decision overturned Roe v. Wade and triggered Idaho's abortion ban. What they found isn't good. We have fewer OBGYNs in Idaho, fewer specialists with expertise in early pregnancy problems than we did more than 15 months ago. Practicing medicine in Idaho was an exclusive profession to begin with.
The physician and provider sort of supply in Idaho is the lowest in the country per person.
In January of 2022, the Association of American Medical Colleges listed Idaho last with fewer than 200 doctors per 100,000 people. The COVID pandemic didn't help, keeping more people away from a career in healthcare and pushing seasoned physicians toward an early retirement.
And so we became more concerned that the environment in which we're practicing became more and more harder to practice as time went on.
Hostile workplaces and physician burnout were both topics being tracked by the Idaho Physician Wellbeing Action Collaborative, but they added another focus during the summer of 2022.
When Roe v. Wade got overturned, we were concerned that the supply of people taking care of pregnant women would diminish. We were interested in see what would happen.
What did you find then in that 15 months after the Dobbs decision?
So there's about 1 million women in the state of Idaho. And we found that there are about 260 OBGYNs taking care of those 1 million women. We found that about 50 to 60 either retired, quit practice, or left the state,
leaving only 210 obstetricians practicing in the Gem State, a drop of about 22%.
We also found that more than half of the maternal fetal medicine specialists left the state during that period. We also found that only 2 OBGYNs moved to Idaho during that period. Highlighting
that loss in access to maternal care, several labor and delivery departments have since shut down across Idaho or just across the border, beginning with Bonner General Health in March of 2023. St. Alphonsus shut down its birth center in Baker City in July, and just this week, we learned West Valley Medical Center in Caldwell will close its labor and delivery and NICU units by April. All three suggest this was a supply and demand decision. They're not getting enough people that are giving birth to babies that need to use these services at these locations.
Yeah, I mean, that's some of it, but you've had a population that's increased in the state of Idaho. So the numbers of babies have increased in the state of Idaho. The other part is that the supply of doctors. When I look at what happened at West Valley, the conversations I've had is that they can't recruit people to do the work that needs to be done. It's not a shortage of pregnant ladies, it's a shortage of workers.
I've heard that. You've heard that from doctors who were there.
Yeah.
Okay. The next big question is, did your study, your research, did it tell you why?
We haven't looked into why yet, but we know most of these people. We know their kids' names, their dogs' names, where they got a tag to hunt elk, and if they got their elk or not. And so we can ask them and hear what they are. A lot of it is just the difficulty of taking care of people and the standard of medical care. They feel affronted with that.
In Idaho?
In Idaho, correct.
Because of laws?
Because of the laws that we see today.
Idaho's abortion ban went into effect in August of 2022, threatening anyone who performs an abortion with a 5-year prison sentence and a loss of license. Dr. Deb Roman,
I think it's shocking,
says the exceptions allowed are too confusing.
What I'm seeing actually is I'm seeing a lot of despair in the physician community. Our training is that we provide the best care we can to our patients based on the standard of care. And when we don't have a situation where we can easily do that, or where there's confusion around that, then our concern is that the patients will not have the best outcomes.
What is the reason people are not coming or getting into this profession in Idaho?
Well, I think that when you think about where you want to live and where you want to practice, you want to be in an environment where you feel comfortable and you feel you can get the care that you need. Some physicians just don't feel that they can practice in the way that they've been trained, so they may not be as likely to come to this state.
Is it too simple to, I guess, blame this on one thing and one set of laws in Idaho?
Yeah, it could be. I mean, there are many different reasons why people come and go. One of the things that stuck to me is that you had about 50 to 60 people quit or go, and only 2 people come, and so that's a problem. The roundtable that we have, has hypotheses about why that is, and we probably ought to figure out ways to recruit people or retain people to this state.
Does that table include lawmakers?
We've invited lawmakers. We haven't had many people show up to that table. Would love to have folks show up to that table, but it's got to be an authentic conversation. I mean, I think everybody has the same endpoint, which is we really want the people in this community to be very healthy and to pursue freedom and enjoy happiness as much as they are able to do.
Okay, so as of November 2023, we were down to 210 OBGYNs, obstetrics physicians in the state of Idaho. I asked the doctors today where we should be. They said about 300 is where we should be. Believe it or not, Dr. Roman and Dr. McEachern, believe this is a solvable problem. They resolved big issues before with this group, but they do need more people joining them at this big round table. There may be some of you out there pointing at other factors involved in our overall doctor shortage. The average age of Idaho's physician workforce is, yes, it's older than the average or the overall standard across the country, outpacing most of the country. There's also the lower birth rate claim. In 2021, there were 22,427 live births in Idaho, a fertility rate of about 61 per 1,000 women aged 15 to 44. In 2011, 10 years earlier, that rate was about 72.3. The factors can include all those things, but the report released this week is pointing out the timing of the 22% drop. It's kind of curious. And the fact they can't recruit doctors to Idaho, with only 2 moving into the state over the same period, that part is also alarming.